million people in the northeast of England face tighter lockdown restrictions from tomorrow as coronavirus cases rise and testing delays continue.
And just a few minutes ago, Health Minister Edward Aga admitted that lab capacity is one of the main problems for the testing chaos we're seeing. And in fact, I think we've got some images which have caused a lot of confusion of empty test centres. And people are thinking, hang on a minute, I can't get a test. And that testing centre is completely empty. What's going on? Well, it now seems that the problem is they're having to sort of stop the testing because the lab hasn't got capacity for processing the testing. So that's what's holding it up. I mean, it's all just a bit of a muddle, isn't it? Or it certainly feels that way from our side of the fence. So to discuss this, we're joined by Julie Cornwall, a key worker who has been waiting days to get tests so her 18-month-old daughter can go back to nursery and she can go back to work, like we're all being encouraged to do. From Kent, we have Nadra Ahmed, the chair of the National Care Association, and she says delays are risking more lives. And Emily Profit, the head teacher of the Cooper Perry Primary School in Staffordshire, who says the fiasco is ruining pupils' education. And also from Oxford, we're joined by testing expert Dr. Duncan Robertson. So between all of you, I reckon we can sort this out, hopefully, or get some clarity anyway. I want to come to you, first of all, Emily, if I may, because the front page of The Guardian has something that I know you'll be instantly thoughtful of. It says thousands of teachers forced to stay at home amid lack of testing. Up to 25,000 teachers in England may have already been forced out of the classroom into self-isolation amid this national shortage of COVID tests. And, of course, that means it's not just affecting them and their families, it's affecting the classes and very often the year groups that they teach because they're in a bubble. And then, of course, all those parents that are now suddenly having to be at home. I mean, it must be having a huge impact.
It is having a huge impact, and there's real fear moving forward that if more and more teachers are forced to remain at home, either waiting for a test or isolating for 14 days because a family member's showing symptoms, that we're actually not going to be able to open bubbles, open classes, and we can't afford to replace those teachers currently. There's just not the money available.
So Boris has said, don't send them home unless you've got the positive coronavirus test. But, of course, your concern is that until you get that result, you don't want to be at risk of putting others at risk. Very, very difficult situation. I mean, Nadra, Matt Hancock has said healthcare and teachers will be prioritised with tests. Does that give you much comfort?
Well, I know it should. We have 10 tests within school that are emergency tests. We're not being able to get tests anywhere. Parents reporting that they're waiting for hours, that they're waiting on computers for an entire day to try and get into a test centre. So if we are prioritised as teachers, how is that going to look moving forward? How are we going to get the test results back quick enough?
In fact, that's what I was going to ask Nadra, because, of course, your concern is those your people that you represent, the carers, are needing to keep themselves safe. So if teachers are being prioritised, where does that leave those people and those people looking after people in care homes?
Well, I think that's the biggest issue that we have, because we're obviously looking after some of the most vulnerable people in the country, and we've not been prioritised in the past. There's been no protective ring, as was mooted, and this is a time where there's great levels of anxiety because we've tried to ensure that we can stay as safe as possible, and testing is the key. Delivering the tests is only half the solution to this problem. It's actually getting the results within that 24-hour period so that we can keep the services running in the safest possible way that we can.
Julie, if we can come to you next. I mean, you're a key worker. You're currently at home with your 18-month-old who is displaying symptoms of COVID-19. It hasn't been confirmed. But until you can get a test, I mean, essentially, you can't go back to work. How is that affecting your life?
It's a nightmare. The little girl's teething. Her tooth's come through now. She's absolutely fine. She had a bit of a temperature on Monday. I've had to come out of work. She's not allowed back in nursery. My whole life.
So you think the temperature was more to do with teething, as it turns out, do you, rather than the test? But you still have to wait for that result, basically.
I'm at home. None of us are ill. None of us have got, I have no symptoms. Isabella was teething. The tooth's come through. She's running around now, playing. None of us are showing symptoms, but I still have to have the test, even though we're both at home and fine.
So have you got a home testing kit there?
I'm waiting for it. Since Monday, I've been trying. I've drove to sites. They wouldn't test my daughter because she's under 5. I've been online from 7 o'clock in the morning till 10 o'clock trying to order a home test or book a slot somewhere. It's took literally till yesterday for me from Monday to finally get a test booked, sent to the house. It's not here yet. I'm going to be off work at least 2 weeks.
I mean, it sounds like a job in itself, just trying to get a test. Once that home kit arrives, do you feel confident enough that you can actually do the test and feel confident that you've done it right?
On myself, yeah. On my daughter, no way.
It's a mess, isn't it? It's an absolute mess. Dr. Duncan Robertson, and how can we resolve this? Because it's worrying at the very least for people and potentially life-threatening if we don't get this sorted out.
Well, absolutely. And, you know, one of the things I would ask my MBA students when you sit them down is what's the strategy, right? And, you know, I think the Prime Minister said it was to prevent a second wave that overwhelms the NHS. That's not quite the same thing as preventing a second wave. And you might think it's about minimising deaths, minimising people in hospital, but we haven't really been told what the government's strategy is. It'd be useful to know. And of course, this isn't a new thing. If you look at the data back in 23rd of August, the number of people looking for tests exceeded the capacity. And that's when we started hearing about throttling of tests. And this first started in Blackburn with Darwin, and it's been going on ever since. So, you know, 3.5 weeks ago. So, for example, you know, when I was doing research for this on the beginning of September, 2nd of September, I looked, where's my nearest test centre if I need it? And at that time, it was in the Isle of Wight. And I don't know if you know about the going to the Isle of Wight from here, but it's basically a 75-mile trip according to the website. But of course, it's 85 once you drive. Plus, you need to get a ferry, all to have a swab stuck down your nose. So that's a bit of a disincentive to getting tests. I have a test centre 2 miles away, but you're obviously putting people further away to prevent the...
So, now, what's your solution? What is your solution? Because you're a testing expert and you can see the challenges. There's a huge need, there's a huge pressure, and a lot of money's been spent on it already. So how would you solve it?
Well, I think there's a lot of guidance coming out about, for example, from the Department for Education, listening to the head teacher there, about phoning a helpline. And, you know, this isn't the same as phoning up your mobile telephone company asking for an upgrade. This is really serious stuff. So you need to be able to speak to experts. And those experts are in the NHS and they're in Public Health England. And, you know, they're not in NHS Test and Trace, which, of course, is nothing to do with the NHS. So you need to repatriate it. And it's also the expertise is in local councils. Each local council has a director of public health who's an expert in knowing what to do. And you need to get the experts locally working out what's happening in their local areas. I can look at a spreadsheet, but I don't know what's happening on the ground. The local councils know all this intelligence and they need to be given the resources to sort it out.
Can we bring in Dr. Hilary at this stage? Dr. Hilary, what do you think about testing and how we fix it?
Well, look, if only 8% of people with positive tests are getting their results in 24 hours, it means that 92% of people with positive tests are not having their contacts traced. Those thousands of people are out there spreading the virus to other people. So this is how the virus gets out of control, through inadequate testing. Now, if you prioritise patients, which you have to do, patients have to be seen and tested first so that we know what we're treating. Then the NHS staff come next, and care home staff need to be tested so that we know that those residents and those patients are safe in their hands. But if we're not testing within the community, we don't know where the virus transmission rate is highest, and we don't know how to control it. We can't put in local measures to keep things under control. So testing is absolutely key to keeping everything under control, and currently we haven't got that. And one of the problems is the logistics. We've never looked after NHS staff well enough. We promised the public that we'll have a world-beating NHS system, which we have done thanks to the staff, but we never look after the staff. And now we haven't got enough of them in labs to process the enormous number of tests. So we've got samples that are arriving, they're leaking, the packaging has to be undone. It's taking a huge amount of time, and we're stuck in that situation now. So we need more people, and again, I agree totally with Dr. Robertson there. We need experts advising people on what to do locally, because we just haven't got that guidance.